Interprofessional Education. This is Gina Toomes. I'm a graduate student with Liberty University, and we're going to be discussing interprofessional education today. Hello, my name is Gina Toomes. I'm a graduate with Liberty University, and we're going to be studying interprofessional education. What is interprofessional education? Well, it's when two or more professions learn about, from, and with each other to enable effective collaboration to improve health outcomes. Let's talk a little bit about that. So we come together and we learn to talk as a collaborative team, but it takes a while to learn that. So sometimes we need to look at that, and we need to start that early in the education process, where they can learn this information, and when they get out of school, they can just go right in and become an effective team member. Well, let's talk about the team. What is the team? We have the pharmacist, we have physicians, we have nurses, we have radiologists, we have physical therapy, and even chaplains, case managers, dietitians. Our teams are so knowledgeable, but each one of us is knowledgeable in our own field. So if we work collaboratively together, we're going to have better outcomes. If we discuss what the patient needs, like with the nurse discussion with the physician on what the patient is needing at the time, or pharmacy and the nursing and physician work together to make sure the medications are properly dosed and make sure that the patient is getting the right type of medicine for his illness or her illness. And radiologist, if they talk to the pharmacist, to the physicians to give them the results of certain tests, or to the nurses, where we'll make sure we give the right appropriate care. And physical therapy, they might find something out about a patient that they can't ambulate well because of some illness or some part of the body that's not working properly. If they are working with nursing and asking them a certain way to get the patient up, and just talk about what the patient's needs are and how we can make them more mobile throughout the day. And then, of course, the chaplain. We need them so much when we want them to talk to the families, or even sometimes we need them after a stressful day, or if we had some poor outcomes with families and with the patients, and they might not have done very well. So the chaplain will help with that as well, even if they needed to help us as team members. So as you can see, a team approach is just wonderful if you collaborate together. Why is this approach so important, though? Well, first of all, the patient is number one. And if it improves patient outcomes, why haven't we done it forever? So we want to improve that and give the patient a high quality of care, and we want to decrease the cost. And what that does is it makes sure that we're giving the appropriate care for the patient. And if we're collaborating as a team, maybe 2 x-rays doesn't get ordered from 2 different physicians. So we really need to collaborate and make sure that doesn't happen for the better needs of the patient. The following professions made a commitment to use interprofessional education within their curriculum in February of 2012, and that included the medicine, nursing, pharmacy, public health, and dentistry. All of these professions made a commitment that they would incorporate this in their curriculum. The National Center for Interprofessional Practice and Education was founded in October of 2012, and their mission statement went as this: the National Center offers and supports evaluation, research, and data that ignites the field of interprofessional practice and education and leads to better care, added values, and healthier communities. Now, doesn't that sound nice? If we all collaborate well together and we learn at the educational level, it will be so much easier to transfer into the collaborative practices if they have been doing it all along in their educational process. Well, there's other teams. We have massage therapy, we have acupuncture, aromatherapy, and dry needling. All of these professions can help with pain management. Many back surgeries or back surgeries or people who have chronic back pain can benefit from all of these different professions. The University of Texas actually had these professions come to their class to incorporate that within their curriculum for the medical students, to see that there's other ways for pain management besides just prescribing medications. In May of 2011, the Interprofessional Collaborative Practice Core Competencies was written by all these professions as well. And let's just talk a little bit about that, the benefits from that. It increases the respect and ability to work well together. That is huge. I don't know how many times as a nurse that I've seen where we didn't work well together as a team. Either the physician was not quite nice to you when you call for an order in the middle of the night, or just didn't want to hear what you had to say. Well, this particular way of collaborative practice helps us to understand that each one of us has, instead of working as silos, has the responsibility to work well as a team to have better outcomes for the patient. So we need to do well with that and understand that it is important that we listen to each and every one of our team members to where we can have a better outcome for that patient. And we also can integrate better strategies to make the patient better, to improve their health while they're at the hospital or in the public domain. Many chronic illnesses will need, a lot of collaborative practice. They may have several physicians and several different dietitians or case managers or home health coming out, and it's really important that we do a lot of collaborative practice. We incorporate technology with that too, with like our electronic medical records and Epic, where we can actually see what the patients have gotten from other physicians. We've came a long ways with that, where make sure that the medications that are prescribed from each physician work well together for the patient and have better outcomes for that patient. The Interprofessional Education Collaborative Core Competencies were established in May of 2011, and what they did is they improved population management with chronic illnesses such as CHF, diabetes, long-term chronic illnesses that need a lot of collaboration. They improve health care delivery for patients in public health to preventive care, public health workers on health environments and disaster preparedness, and they utilize informatics like we discussed just on the previous slide. We implement evidence-based practice and we provide patient-centered care. I know I've really discussed this a little bit more on the slide before that, but we cannot emphasize enough the importance of collaborating as a team. So how do we integrate it in our education? Well, we need to collaborate with other healthcare professions and see. You do team simulation, integrating more than one profession. Um, One of the exercises I'm going to try to incorporate in my educational lab is where I'm going to have a vented patient for our nurses to be working with. And our radiology department is going to come and do a portable x-ray that they do on actual vented patients every day in the hospital. And the radiology department wanted the outcome to be having help from the nursing staff to actually set the patient up for a portable x-ray. They seem to be having difficulty having the staff to assist them with that. So my outcomes would be that the nurses would assist them without having to ask for assistance. Just little things like that can make a huge difference. Radiology, as they're moving that patient, could actually pull out that tube without assistance. So it is really important that we work together as a team on that. And so, just our two teams thought that would be a great little simulation in the spring that we're going to try to implement. It is key to start in education to have better communication skills in the healthcare setting. I think that is so true. If we begin then, just like different ways of telling or helping the student to communicate is huge. So many times they'll get out of school and they'll go into practice and then they are scared to death to talk to anyone. And sometimes they're so scared that they don't notify physicians or other staff members when their patient is getting into trouble. So it's very important that we teach them the importance of working well and communicating with each other. And that's my references. I want to thank you for listening to my slideshow today, and I hope that you will integrate your interprofessional education into your curriculum. Thank you and have a good day.